good morning, good afternoon, good evening, and welcome. Whichever part of the world and whatever time zone you are in, thank you for joining us for the 2021 edition of the Black Consciousness Festival. This year, we are inviting you to shift. Join with amazing people across the world as we explore the many ways we, as people of African descent, grow, cultivate, produce, share, and rebirth ourselves. Through our ancestral knowledge, historical legacy, pride, power, and practice, let's celebrate the individual and collective ways we navigate through life. Together, we continue to walk in pride, power, and practice. Enjoy the session.
If you want to go fast, go alone. If you want to go far, go together. An African proverb. My name is Erica Ashton, and I'm the festival director for the Black Consciousness Festival. It gives me great pleasure to introduce this conversation and to introduce the lead for the conversation, our Content and Communications Director, Mr. Sean Samad, will be leading the conversation on transforming community leadership and governance from an Afrocentric lens. I look forward to this very interesting discussion. Have fun, Sean. Thank you.
Thank you, Erica. Good afternoon, all. So I just want to introduce this conversation. This conversation is going to be exciting, I can tell. And the two people joining me, Ms. Kimberly Ental and Mr. Lieben Geber Mikael. Just quick introduction. Kimberly is a founding partner of the Miss Education Project, an organization dedicated to deconstructing the hidden narratives and addressing salient and unspoken issues facing today's society. And Lieben is the executive director of TAIBU Community Health Centre, which provides primary health care, social community capacity building, and much, much more. But I want them to tell you about it. So over to you, Lieben.
Good afternoon, good evening, good morning, good day, greetings. It is a very great honor and privilege to be among you today to have a conversation and share some of our experiences around engaging and transforming community leadership and governance. As we have just been informed, I am also very honored to share the space with my previous boss, colleague, mentor, friend, and partner in crime, Kimberly Tull. But before we go into our meaningful conversation, I would like to do a land acknowledgement where Taboo is located and where we are providing our services, including where Kimberly is also working. We are situated in the traditional territories of the Huron-Wendat, Anishinaabeg, the Chippewa, the Haudenosaunee Confederacy, and most recently the Mississaugas of the Credit River First Nations. Where we are located here in Ontario, it is covered by 46 treaties and other agreements that is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements, including the One Dish with One Spoon Wapen Belt Covenant, are agreements to peacefully share and care for the lands and its resources. Other Indigenous nations, Europeans, and newcomers were invited to this covenant in the spirit of respect, peace, and friendship. So we are mindful of broken covenants, and we strive to make this right with the land and with each other. I am also would like to reflect on the ancestral acknowledgement. We are all treaty people here where we're located. Many have come here as settlers, immigrants, newcomers in this generation or generations past. I would also like to acknowledge African people that have been stolen from their land and forcibly transplanted in Turtle Island as a result of the transatlantic slave trade. Therefore, I honor and pay tribute to the ancestors of African origin and descent. And thank you for taking time to share this reflection with us. So, in terms, we have had some introductions. So, Kimberly and I will be presenting. Um, so, I'm just going to skip this very quickly. And this is what we are hoping to have a conversation or a presentation first and then a discussion. We want to share with you what Taibu is and when and why this organization was created. And then we want to use Taibu's example with two areas of work that we have led. One, which is the Black Governance and Leadership Project, and the other one is the Ubuntu Village Project that brings the Afrocentric lens into the work that we do, that we are striving to move from transactional operations to transformative operations and community engagement. So Taibu is a community health center that was established by a parent organization or a sponsoring organization called the Black Health Alliance. We're located in the northeast corner of the city of Toronto in Scarborough. And our mission is really to provide primary care and other social services to the Black community across the Greater Toronto area. But we also serve our local residents within our geographical catchment area. And over the years, we have developed capacity and focus to serve the Francophone communities in our neighborhood. And we are supporting the services and community engagement of Indigenous communities as per our Indigenous Health and Indigenous Hands principle. And we work with an advisory council to help them establish community engagement and programs in the community. As you can see, our values are really very community driven and based on Afrocentric or Afrocentricity, establishing who we are as an organization. Our board of directors have identified 3 strategic directions, which we're hoping to get refreshed in the following year in 2022. But one is looking internally into the organization and looking at operational efficiency and resilience. The second priority is looking around and thinking about how we can develop strategic partnership and alliances, because the work that we do around equity, it cannot be done just by one organization. And the third priority is looking ahead in raising Taibu's profile so we can engage in movements for action and change. So as I said earlier on, the organization was started about in the early 2000s with the Black Health Alliance, who really, the Black Health Alliance is an organization comprising of Black health professionals and Black organizations coming together to improve the health and well-being of Black Canadians. And in the early 2000s, they engaged in conversations and engagement with the communities and this idea of creating a center that is focused on providing primary healthcare and community development programs for Black Torontonians was incepted at the time. And through various challenges, engagement, negotiation with the government, in 2005, they were successful in getting the approval of the provincial government to establish the first of its kind, a center, a community health center that has a mandate to work with the Black population across the GTA. And since then, we have been, 2008 is when we became an entity, and then since then have started establishing our governance, our boards, our operational staff, and moved into our new building in 2011. Over the years, we have grown from a budget, for example, of 2 million at the beginning when we started to about 9 million this year. Our staff has also grown from 8 in 2009 to 61 this year. And then our engagement with clients, as you can see, has also grown over the years. So this is an organization that is really growing in capacity, in reach, and in activities and programs and services. Our CHC is part of a larger provincial association of community health centers. And so we ascribe to the Alliance of Healthier Communities model of health and well-being. But as an organization that is focused on the Black population, over the years, we have really started to incorporate Afrocentric values and principles into the work that we do. And so about 3 years ago, we started infusing Afrocentric values and principles such as the Kwanzaa principles into our work to be able to make sure that what we do is informed by who we are as an organization and our mandate or raison d'etre. And so we have used these values and principles as guiding principles and translating them into the work that we do through various descriptions and indicators. For example, self-determination is very important to what we do. And so we always make sure that communities are involved in decision making under the principle of nothing about us without us. Um, the spiritual component of who we are as people is also part of what we do in terms of our services, whether it's clinical services or other community health programs that we do. And through that, we have developed a model of health and well-being that helps us to infuse these values and principles into the programs. And so our goals are like mainly prevention of chronic disease and ill health, restoration of our health and well-being, and then advancement as a community, not just physical health, but the well-being of a community in general. And we use those guiding principles to help us develop and implement our program and services. And last year, we've started a process whereby we're also now developing an evaluation framework and a theory of change that is really rooted in what we do as an Afrocentric based organization. And this is something fairly new, and we're hoping that we would have a complete package by the end of this year. As I said earlier on, there are many Francophone communities who are predominantly from the African continent and the Caribbean islands. And so there was no services in Scarborough, so we had engaged in providing those services. There are only 2 organizations in Scarborough where we are in our neighborhood that are designated to provide French language services. One is a long-term care, and the other one is TAIBU and providing those services. And as I was saying earlier, 95% of those Francophone communities are immigrants, newcomers to the country. So there is a lot of need when it comes to income and poverty or any other kind of services. About 62% are on the low income range. And 73% are from the African continent, and about 19% are from the Caribbean islands. And the programs vary from clinical services to food security initiatives, or even doing community engagement and programs online, obviously because of COVID. I also mentioned about the Indigenous mental wellness program that is delivered by the Indigenous communities, and we're supporting those. And right now, we're also focusing on making sure that we are also within the Indigenous communities. We are starting to target the Black Indigenous communities who are also facing many barriers to accessing services, programs in the community. In addition to providing our primary care clinical services with our doctors, nurses, and allied professionals, and other health education, health promotion programs, we also do some strategic kind of campaign and advocacy. This is a program that we worked with our City of Toronto around Black mental health, raising the awareness of Black mental health. And through our engagement with the city in 2019 proclaimed the first Monday of March as Black Mental Health Day to help us have conversation throughout the city, and now that has gone throughout the province and throughout different cities in Canada. And this year, in 2020, the city of Toronto advanced what proclamation they did the year before, and now it's the first week of March that is declared and proclaimed as Black Mental Health Week. So we do some kind of strategic engagement and advocacy work as well. COVID has been a significant challenge, as you all may know, and it had also disproportionately impacted Indigenous, Black, and other racialized and newcomer communities. And so we have been very active when COVID hit, in terms of the engagement, providing information, providing access and facilitating access to testing, but more importantly, also providing support, whether it's financial support, housing assistance, food security initiative that we have been doing. As you can see from this poster, 1 in 4 COVID cases were affecting Black families in Toronto. And then we were also very active in the rollout of the vaccine clinic, making sure that people had a comfortable space. People who really wanted to take the vaccine had a comfortable space to come where they can reflect themselves in the services. They can come and ask questions from Black doctors and Black nurses. So we've also been doing that. So since April, we have we have rolled out about 23,000 vaccination plus. We have engaged, provided support to community members, over 10,000 members. We had a helpline where people were calling us to ask questions or to seek services. And those are the kind of programs that we have done. COVID-19, digital equity was a big issue. When COVID hit and programs stopped, most of our seniors were challenged because they couldn't come to access programs and services. So we developed a program through resources and grants that we got to ensure that our seniors and our young people could participate, whether it's on online programs and social engagement programs or school, and provided digital equity support to our communities through laptops, smartphones, internet connection, for those who were not able to afford that. So that's the kind of overview of the organization. And very quickly, I wanted to start by sharing information about the Black Governance and Leadership Project. This also came out of the city's, Toronto City's action plan to confront anti-Black racism. I believe it's the only municipality in the North of America that has an action plan to specifically address anti-Black racism. And out of those action plan, there was a recommendation to increase the representation of Black Torontonians on board and governance spaces and leadership spaces. And the city put out a request for proposal. And in their request for proposal, a few organizations came together. The University of Toronto Scarborough, East Scarborough Boys and Girls Club, the Alpha Alpha Delta Omega chapter of the Alpha Kappa Alpha Sorority Inc., to design this project that we call the Black Governance and Leadership Project to address anti-Black racism in governance and leadership spaces. And the city really was interested in training members of the Black community and matching them to board opportunities. But we, in our proposal, submitted to the city and said that is one thing that can be done and it's very easy to do, but there are two most important things that need to happen. The first one is supporting grassroots young and emerging Black organization that really have finding difficult to thrive, and they pop up, they get some funding, they do some great work, and when the funding ends, the organization also die. And so we developed a module to support these organizations through capacity building around governance and leadership. So we have a sustained, strong community resource. But the other most important aspect was the phase 3 of the project was engaging mainstream organizations. Our argument to the city was, it's easy to train people and match them to board opportunities. But board spaces, as we know, especially mainstream organizations and big institutions, have, do not provide a comfortable and meaningful space for the equitable participation of Black, Indigenous, and racialized group. And so we said the problem relies with organization, and that's where we need to bring about some changes, whether it's board processes or whether it is power dynamics, or the culture of the board needs to change to be able so that when Black people are entering the space, it is accommodating for their need and their voices can be meaningful and their participation can also be meaningful. And part of the reason why we got engaged in this work is, as you can see from data that was provided by Ryerson University in 2020, is the underrepresentation of Black people in board spaces, whether you look in Toronto, for example, or in Montreal, for example, where the population, the Black population is about 6.8%. But you can see in corporate, voluntary, hospital, university, or school boards, there is no representation of Black people. And where these places where decisions are made, policies are put out, we are not represented. And this is why we were trying to change. It's the same thing in Calgary, for example, or in Halifax, where there is very, very dire underrepresentation of Black members into the board spaces. And so that's the idea of the Black Governance Leadership Project. But it's not just about representation and numbers, because you can have numbers and you can tick boxes, but it's about what happens in the board. And so the BGLP is about decolonizing the board spaces. And I'll let Kimberly continue the conversation there.
Thank you, Laban, and thank you all for the organizers, and the space is much needed, and I'm happy and thankful for being in it. This quote that is up on the slide, that when we're not at the table, we end up on the menu. I first heard that from Laban, and we'll give credit to that. But when he mentioned it, the first thing that came to my mind was bell hooks, eating the other, the desire and resistance, and basically talking about the consumption of Blackness. And then I thought about Audre Lorde's work around, and her quote around, if I didn't define myself for myself, I will be crunched into other people's fantasies for me and eaten alive. You heard Laban speak earlier about self-determination as part of that lens and part of the work. And so we have to define and carve out our spaces for ourselves, and do so in a way that's bringing a level of intention and authenticity to who we are as a people. So that it aligns with traditional African principles and practices, and it doesn't conform or assimilate to current oppressive structures, where we end up losing sight of who we are as a people. It's also important to acknowledge that the existence, and this is on the next slide, Laban, so that the existence of and impact of anti-Black racism is a systemic issue, and within organizations and the boards that govern them. And for Black-led and Black-governed organizations, we have to take on practices that aren't necessarily inherent to us, because we need to adhere to those practices for funding or legitimacy. And so it's reconciling those kinds of tensions. So what does this mean when we talk about decolonizing board space? We're looking at disrupting and interrupting Western white supremacist colonial society and creating our own. We exist currently, and we existed outside of those structures long before. And so those richness, those histories, those stories, those knowledges need to be brought into the spaces in which that we create, and even spaces that weren't created for us. And we'll talk a little bit later about how do we change some of those systems. Dionne Brand, she's a brilliant Canadian poet and novelist. She wrote an article last year after the racial awakening, or the resistance after the murder of George Floyd, and said, I've been living a pandemic all my life. It is structural rather than viral. It is the global state of emergency of anti-Blackness. What the COVID-19 pandemic has done is expose even further the endoskeleton of the world. And that those last two sentences really hit home for me. This is who we are on a global level, not we as in Black people, but the broader global perspective. It's colonial, it's anti-Blackness, and this is the undoing the work that we as Black people have to do collectively, which we're seeing with this festival. And it's also work that non-Black people have to take up. It's not just on our shoulders.
Our societal foundations, the endoskeleton is flawed, it's damaged, it's corrupt, it's harmful, and it serves a specific purpose. So how do we go about reconciling these tensions between harmful practices, identity, legacy, history? As we know, we're not of this world and of these structures, but we are forced to function within it and expected to thrive. So our work with TAIBU itself, and on the board level, have been working to move, or in the spirit of this festival, shift to a lens that centers Black experiences and celebrates Black excellence, thereby valuing, including perspectives, norms, principles, and methods of Black knowledges and experiences, rooting the work in African-centered principles and values. And they do so, and the last point on this slide will be around creating the process of accountability, which is an Afrocentric principle. One, to yourself, and then accountability to each other. And this is the tricky piece because it requires honesty and humility and us to see and own the truth, which a lot of folks don't want to because the truth is comfortable. So the work of decolonizing the board is bringing in an anti-colonial lens and about building trust. And for non-Black boards, and I would even say Black boards, it's challenging them to move through the process of becoming an advocate and earning the status of allyship, because we know Black communities are not monolithic. It's not a homogeneous population. We are rich, diverse, colorful, we're all of it. And so we have to think about who's not in this space. And Lieben mentioned the Francophone community and Black Indigenous communities. And if they're not at the board, then we're not doing what we're at the board level, we're not doing what we set out to do. We're doing all this from a very particular perspective. So our starting point isn't rooted in deficit. Instead, we focus on Black identity and Black excellence and knowledge systems. However, knowing where we're situated here in Canada, we have to apply an anti-Black racism lens to this work. And we do so because of where we are, but we have to be mindful that we're not defined by anti-Black racism. Anti-Black racism is something that happens to us because of the oppressive system. So the definition that we use for anti-Black racism is that it's defined here as policies and practices rooted in Canadian institutions such as education, healthcare, and justice that mirror and reinforce beliefs, attitudes, prejudice, stereotyping, and/or discrimination towards people of Black African descent. This definition comes from Dr. Akua Benjamin, who's the first person to express that, also from Ryerson University, and it seeks to highlight the unique nature of systemic racism on Black Canadians and the history as well as the experiences of slavery and colonization of people of Black African descent in Canada. So we've created through the Black Governance and Leadership Project a pathway to addressing or redressing anti-Black racism at the board and governance level. And this pathway starts with us creating spaces for reflection and accountability, moving through to asking questions, the inquiry of what is Black in Canada, and then what is anti-Black racism. And that's just not for non-Black boards. We've actually done this with our Black-led board of TAIBU when I was on it, which is also a hard conversation to have. Then moving through to examining anti-Black racism and its impact on Black communities through the determinants of health, the social determinants of health. And then lastly, addressing anti-Black racism through accountability and advocacy. So we have 4 A's that are part of this. And the 4 A's are acknowledgement, which really focuses on recognition of power and privilege within spaces. Accountability, which is the honesty part, and the responsibility part, being responsible for your decisions and the actions. And the work that needs to be done needs to reflect and embody the principles of anti-oppression, anti-Black racism, and Afrocentricity. Advocacy in terms of standing up in spaces for people who cannot be in those spaces themselves, and to do the structural and due to structural and systemic barriers. And it requires openly and unwaveringly supporting the priorities of the communities lead. It's not happening to us, right? So if you're going to be an advocate, you must listen to community and be present in community, which takes me to then the allyship. And I know this is a word that I have mixed feelings about, which I won't get into because that's a whole nother session. But it's really about making room for people to stand up for themselves, right? And I always like to say allyship is a verb. It's not only a noun, it's a verb. It's doing the work, it's being present. So when we're thinking about all these things, And then you're thinking about it from a governance standpoint, and that's a particular lens that we have to always come back to when we're thinking about this, because it can get broad and it can start to encroach into different areas. But specifically as it relates to board responsibilities, we think about it from these three perspectives: fiduciary, strategic, and generative. And if we're thinking about Afrocentric principles, fiduciary is around trust and responsibility. Strategic is around that visionary, that purpose, that generational building, that legacy building. And generative, the insightful piece, is about being reflective, ideating, listening, honoring histories and knowledges that have come before us and knowledges that are currently in the space or in the building. So with that, in that spirit, we started to think through recently, what are some models out there that are related to governance and leadership? And we've identified a few, and most recently started working with the board. So I'm no longer, for full transparency, I'm no longer on the board, which is, I'm really disappointed about that. I might just go back leaving. But I was happy to be able to go back and work with the board to start thinking through some of these Afrocentric principles, Afrocentricity as it relates to board governance. And so we've been doing some work around the Ubuntu leadership model. And it's listed here as 4, it's really 6 principles around collective leadership, humaneness. So collective leadership, I should go back, is about the solidarity, communality, and definitely community voice being at the core. Humaneness, the pervasive spirit of caring and community. The self-awareness and mastery is really the emotional intelligence component, understanding yourself and being able to govern yourself accordingly, and being aware of how you make decisions based off of the way that you're feeling, your emotions and your understanding, and your location. And then relational awareness and mastery, that's what I call reading the room. So that's the values-based social empathy. It's a service to others, and it's a broader understanding. So we started digging a little bit more and found the Ubuntu leadership model by Joseph Ebert Young. So he took it a step further through his work with Africa Journal of Management Leadership for High Performance in local councils in Cameroon and Nigeria. And he looked at the Ubuntu leadership model, which is on the left, and then deviant aspects, so ways that aren't Afrocentric, ways that are from colonial structures, and boiled it down to 7 dimensions. Some of it overlaps with the original Ubuntu leadership model, which I just spoke about, but he went down to 7 dimensions around interdependence, which we've heard before. That's community, closer affinity, right? The humaneness, people orientation, humanity, the vision and purpose. Performance was added to this, and then ethical practice was also added to this. And so that's really how we do the work in a good way, and how we're actually accountable, and how the board is upholding, or the organization is upholding the moral piece, right? So we, as a board, the board's now working through how they're looking at their policies, their processes, their governance structures with this particular lens. How can they make different decisions based off of these 7 dimensions? We looked from here, we looked even further at other common themes across other variations of African-centered leadership models in the versions we shared previously. So Lieben mentioned Kwanzaa, there's Nguza Saba, similar, Ubuntu. These are some of the common themes that have come out from them, the common traits of African-centered principles, Afrocentricity, when it comes to leadership and governance. So it's focused always on people, on unity, right? That's where we start. It's about the self-determination and defining ourselves, naming ourselves, and creating for ourselves, and speaking up for ourselves, not having others do that or telling us what's needed for us. It's about the collective work and responsibility, and it's about purpose. And that common purpose of the core group, but then of the community, and always keeping those 4 things, at least from what we've looked at over the past little while, at the core of the work that we do as a board. So with that, I'll turn it back over to you, Lieben, to talk about Ubuntu Village.
Yeah, and so in all, you probably are getting the sense of, in all we do with normal services or governance or programs, we are trying to, using our values and where we come from and how we make meanings and relationship based on who we are as people of African descent. That is now where our conversation is going and shaping who we are as an organization and what we do as an organization. And so, for example, this is just one example we wanted to share with you today. Is we've looked at how we're trying to shape our governance and how we do governance, but also influence other governance processes. But when it comes to community engagement and community programs, one of the examples that we wanted to share with you is the Ubuntu Village project. And this came through relationship with communities and really taking time to design a program for seniors. And we wanted to move away from the traditional bingo and arts and crafts and gentle exercise and yoga, which we still do. But the way we wanted to do this was a little bit different. We really wanted to engage people. And if we were true to who we are as an organization and to our mandate, we wanted to really get the people to shape what we do. And this is how the Ubuntu Village project was created. As you probably all know, Ubuntu is a Zulu word, and it means I am who I am because of who we all are, or I am because of who we are. And it's talking about our existence, how we do things is not based on individual Eurocentric values, but as a community and as a village. And so, as we were talking about, our seniors, Black seniors here, we wanted to make sure that they could engage with what they know. So many of the seniors who are here come from a space where we don't have social structures. It's the village that takes care. It's the neighbor that takes care. It's the healer that comes in and support families when they are not well. And it's the spiritual healers and leaders who are really doing that. So we wanted to create that village virtually here. And through a very long process of engagement, we took time in creating an elder council, and through the principles of if we build it, they will come. We turned that around and we really said, if they build it, actually, there's no need for invitation. They're going to be there anyway. And so now we know, all our programs that is related to the seniors are planned by the seniors, are some programs or most of the programs right now are facilitated by seniors, even during the COVID period. So we have created an empowering and decision-making structure where we have the Ubuntu Elder Council, a member of seniors from the community who are planning their various programs and activities. For example, they have created these streams of programs and engagement that they have, whether it's stress management, social health, nutrition, where now we have a very successful nutrition food security initiative where we are providing meals to the community, and this is all led by the seniors. Or a computer literacy program where our local library now have taken the curriculum that the seniors have developed, which is an intergenerational seniors and young people doing computer literacy, and the library is using now for all their computer literacy program, because they saw that our computer literacy program was more engaging for seniors than the ones that they were doing. Or if it is caring around visiting people when they are sick, particularly supporting people with sickle cell disease, or the physical health, where now we have trained elders who are facilitating a gentle exercise program, so building their capacity to do that. We have a laughter yoga program that has now taken off, and the seniors are getting invited in different places. This is a picture of the computer literacy program in libraries. They also do advocacy and civic engagement, so they go and speak to elected leaders and talk about the need of the seniors in the community, or their own initiative of starting, let's say, a toy drive for children with sickle cell disease, which is something that they've started by themselves without us, starting the process. They are identifying needs in the community and meeting the needs, and we're providing them with their support.
Awesome. Thank you, Liban. So these last few slides will wrap us up. I think, and I hope what Liban and I both hope that you've been able to take from this is that TAIBU has moved away from transactional leadership to transformational. When we speak about transactional, that's being focused on issues, that's helping people negotiate existing structures that's no longer acceptable for the organization. Solutions then don't have to transact with institutions and funders just on that level. It's pushing back. It's transactional is also about short-term gains for community, but leaves existing structures in place. The question that I always ask with this one is, what are you willing to change internally to gain externally, right? When we look at transformational leadership, and that's where TAIBU is, it cuts across multiple institutions and sectors, alters the ways the institution operates. They're looking at their culture, values, practices, political will to create racial equity, and it's grounded in values, assets, equity, Afrocentric principles. And the question that they're addressing is, what are they changing internally to lead change externally? We haven't really gotten into power. Can't talk about this unless we get into a little bit of a power analysis of how we see structures. Transactional leadership tends to focus above the surface. It's reactive. It's based off of events and some current trends and patterns, and you can anticipate it. It's visible. The work from the transactional piece is the below the surface line. That's where we're trying to move systems. That's where we're trying to shift structures. That's when we're trying to shift the culture of these organizations. It's trying to think far enough that we can reframe, redesign, regenerate, and be proactive, right? And this is the legacy building, the generational building, so that our kids don't have to fight the same fights that we're battling now. So one way that we're thinking about this from an Afrocentric lens and how to apply this is we're looking to disrupt these power structures, and remembering and understanding ourselves outside the context of anti-Black racism will require us to unlearn and challenge and interrupt our old ways. And we are actually from the same system. So we actually, as Black folks, have to challenge ourselves as much as non-Black people, which is scary. And sometimes it can be sinister to think about what we've been taught to be the norm, which brings us to the model of the me, we world. You might have heard about it. This particular analysis, this time from Africa, developing a relational approach to values-driven leadership, comes from Peretz, Russan, and Painter. They reflected on an executive education course called Values-Driven Leadership into Action, which ran in South Africa, Kenya, and Egypt from 2016 to 2018. And their aim was to broaden Western conceptions of leadership development by showing how African philosophical traditions precedes the literature in its insistence of relational ontology of the self. But with this model, although the researchers are not from the continent, and I don't believe they identify as Black, the contributions to this framework come from those who are Black. And they worked with and co-developed with a diverse group of African faculty members. This model, Coca-Cola and other multinational corporations have used it. You may see other variations of I, it, us, but these are all built off of, when you look at it, Afrocentric and Indigenous principles. It's not new. It's not new to us. And so now it's time for us to reclaim it and use it for our benefit. So we're using this on a board level and at an organization level to do the work of decolonizing and bring an anti-colonial lens to self first, to do the work on the personal level, then through the organizational level, and then taking that up to whatever your worldview is, if that's in your city, your country, globally, to shift power dynamics and going below that surface line that I mentioned before. And that's the work that requires us to do the work on ourselves first. So with that being said, thank you so much. I will turn it back over to Leland to wrap us up.
Thank you very much, Kimberly, and thank you for your time and consideration. So just tying it up to our theme of shifting spaces and shifting positions and shifting, our location, our thinking, our paradigm. As an organization, we are realizing that first we need to look into what we do as an organization, and then take that and to the community and influencing others, whether it's mainstream organizations or like sisters, CHCs, or partners, in making sure that we can slowly bring about change by shifting the way we think, shifting the way we do programs, shifting the way we engage with our partners and collaborators, and shifting the way we engage communities in this process. So we're very, very appreciative of having time to share this with you. And maybe now we'll send it back to Sean and see if we have any questions or reflections or comments to our presentation. And thank you.
Great, thank you, Liban and Kimberly. I mean, I'm so full of positive energy. I don't even know where to start, but let me start by saying um, a little bit about myself, and that when I decided to go back to school after doing my bachelor's, I'd worked in a couple places, and then decided that the thing that most concerned me in my work experiences was leadership, and so I decided that the program that I would go back to study was going to be leadership development. And I chose a very far place up north, even further than Canada, to study leadership. And so hearing you guys talk about this new novel way, but not new and novel, because as you rightfully said, we are reclaiming what is really, an African philosophy, African principles, an African way of living and leading and doing stuff. When I hear you talk about this, it totally warms my heart, and I feel like I need to go back to school, Kimberly. I feel like I need to come and intern with you guys to learn the real way of leadership. Um, but yeah, I'm totally like blown away by what you all are doing there, and some of the things that you said that I want to engage you on in the time that we have left. One of the things that really struck me was about the issue of accountability. Yeah. And we know that it's not that the problem of accountability, the issue of accountability, and you had listed a number of things: acknowledgement, accountability, advocacy, and allyship. But to me, accountability and acknowledgement are kind of like the first two things that challenge us the most. In your work at TAIBU, what is the experience? I know you kind of touched on it a little bit, like when you were talking about having to deal with the issues of what is black and stuff. What has been your experience with kind of getting people to understand the importance of those first two steps of acknowledgement and accountability?
Go ahead.
Either of
Go
you.
ahead, Lisa.
All
Sorry.
right. So yeah, I think in some of the work we do internally, um, you know, the acknowledgement part was not that difficult. We
Okay.
needed time to spend and really reflect on what we know and what we don't know, and
Right.
just like we were saying, who was not at the table and who is further marginalized within the Black community because it's very diverse.
Mm-hmm.
The accountability piece was very important. So I'll give you an example with regard to the Ubuntu Village project.
Mm-hmm.
We needed to put the accountability, right? Because if we say we are committed to serving Black seniors, for example, or seniors of African descent,
Mm-hmm.
we need to, and this is the way we're going to be doing it. Uh, if we want to be accountable, we need to really put the accountability, we have to flip it around,
Mm-hmm.
right? And I usually use this example both internally and also when we engage other mainstream organizations. We get funding from the government,
Right.
and we have what we call an accountability agreement. The government says we're going to give you so much dollars for you to do this X, Y, and Z,
Mm-hmm.
and every year you need to tell us what you've done with the money. So we are accountable to what we are receiving from the government.
Right.
If we want to be accountable to our communities, we have to flip that around, and we have to put ourselves in a position to say, you're going to keep us accountable to what we promised to do. And one of the things we learned with the Ubuntu, and I had to stop making decisions, for example.
Mm.
And so I had to learn to say, when
Yes.
staff would come
To
to
let
me and
go.
they would, yeah,
Yes.
because staff
Wield
would
that
come to me
power.
and we say, we have this thing to do and we need a decision. And I had to learn to say to myself and to the staff, if it's not a health and safety issue,
Mm-hmm.
if there are no legal risks to what is being done,
Mm-hmm.
and if there is no financial issue, we don't need to make a decision. The seniors
Mm.
can make the decision themselves. So I
Right.
had to relearn and say to staff, no, go back and let the seniors make a decision, the council, the Ubuntu Elder Council, make a decision, and then let that decision come to me. And what I'm going to do is I'm going to say this decision has no health and safety issue, has no
Right.
legal risk because the board, like Kimberly would ask me, why did you do this? Or there's no financial implications if they have the budget. So this kind of rethinking and relearning is very important. And that's what we're also trying to say to mainstream organizations. If your engagement with racialized group is genuine, you need to leave the decision making to them and you making yourself accountable to what you're promising to do. That shift has to happen. And that's what is accountable. If there's no accountability, if there's no acknowledgement, then if you don't know, you won't do. But
Right.
once you know, you need to be accountable to do what you want to do. So that's where those 4 A's are really, they're chronological as well, right? They
Yes.
have one has to happen before the other.
Absolutely. And if I can just jump in here, Levy's getting me excited now, Sean. So I'm like, oh, where do I start? I think part of this piece, the acknowledgement piece, also goes to conversations that we could have around performativity. Right? So
And Kimberly, not to cut you, but you know how well we do that in the Caribbean.
Yes, right?
Yes.
Like we name it, we say it, but we say it for face. We don't actually go deeper, right? And so it's that piece around the acknowledgement. Yes, folks are saying and acknowledging things and recognizing things more so now. However, I don't know if the actions are behind it. In the same way, I think we're seeing more folks starting to put some actions behind it, right? And so when we're looking at mainstream organizations, some are extremely willing and wanting to sit down. Oftentimes, they've never even had to think about these conversations,
Of course
right?
not.
So they're like very infant stages of this process. But then when we get to the accountability piece, then that's where things get a little tricky, because you now need to be, because it's not just accountability. Leva and I were on a panel that was facilitating last year in the National Dialogues, Leva for Anti-Black Racism. And we talked about accountability. And I think it was you, Leva, that said it needs to be public, though.
Yeah.
So you can't have this accountability pieces behind closed doors, right?
Right.
I think a couple of things that the board's been brilliant at that over the past few years as they're leading up even for their strategic planning process, being accountable to the community. Going back to community, historically, we just never had that kind of conversation and having the community was part of the decisions, but not involved in some of the co-creation of things. And so ensuring that their voices were in there and then reporting that back and then taking that feedback and then actually hearing the feedback and then implementing that feedback as opposed to just doing it for the sake of doing it. Another just quick example, Lehman and I, as you'll soon realize, we were in a lot of common spaces together. We were on a call, and I won't name the grant, but we were participating in this grant, and they had made a decision that an evaluator did not need to be rooted in anti-Black racism framework or lens to work with Black people. And in that meeting, in terms of accountability, the two of us we didn't coordinate, we both just spoke up because we're like, this is how are you going to be accountable to the community and I think that's how we're accountable to Black communities in the GTA, in the Greater Toronto area.
Of course. And of course that leads me to some of the stuff you said about truth and honesty and trust, which is so essential to any kind of transformational situation. And it struck me when you mentioned that accountability is an Afrocentric principle, and I think that's the first time that I've ever heard that. But what it does when you hear that is that it gives this notion of accountability an even stronger footing, stronger grounding, because then we don't see accountability as this foreign thing that is kind of put on us, but it's something that has always been a part of our culture, has always been a part of who we are, and so it's not problematic to be honest and to be trustworthy and to
be transparent.
To be transparent, it's part of who we should be and
Absolutely.
who we are. Yeah. Amazing stuff. I mean,
I can feel your energy, Sean. I can feel it. It's great.
I mean, some of the questions that I had you guys answered about like why did this clinic come about and the roots of it and anti-Black racism and that kind of thing. The decolonizing stuff I find particularly very interesting for the context that I'm in the Caribbean, because it's a conversation that does not really happen a lot, because we think that we've been independent since 1962, and that means that the ties that we severed with colonial powers means that we're no longer colonial, but it's quite the contrary. Right,
Absolutely.
as I'm sure you know, Kimberly.
Absolutely.
And that, Liban, that saying that you had about when we're not at the table, we're on the menu. I'm gonna be using that. I'm gonna put your name on it and say where it
You
came
can use.
from. Gonna use it. The transactional versus transformational. How long has this process been thought of, and is it something that's active now, or is it something that you're planning towards?
I think, and then Leva, I'll jump in, and hopefully you can add to this. We first started having these conversations in 2018, as an organization and as a board. So I think where we are now, and as I mentioned, I'm a year fresh off. I haven't been part of the board, but it's now part of the culture, and thinking about how to do the work differently. Some of the ways that we were implementing things like that were even just, it seems minor, but I remember us having conversations about interviewing process for the board.
Yeah.
Right? Or looking even a step before the interview process. Are we even doing an audit about who's around the table? Is this reflective of Black communities in Toronto? And if not, who's missing? And if they're missing, why are they missing? Do we have a particular demographic that keeps on showing up? Are we becoming too professionalized as a board, right? And I remember some of the conversations, there was tension there because some folks thought very firmly, and rightfully so, that we don't want to compromise, right? Like the quality of folks that might come through or the process. So how do we ensure that we still have the great people who want to come through and apply for TAIBU's board, but that we do this in a way that actually honors and connects into the way that our ancestors and the traditions and practices of Afrocentricity. And so we started thinking about storytelling. And instead of having like these 1, 2, 3 questions and like this hard interview where someone's like sweating and feeling nervous, then instead give someone space, give them an idea, a theme, and let them tell their story.
Wow.
And then you get to hear more, and you're going to get what you need to get from it.
Yes.
Right.
Yes.
And the pressure won't be there. And some of the most brilliant people came out from that process. And so those are the ways that we were thinking about the transactional versus transformational. There's other ways that I'm sure Leva will probably share. Leva?
Yeah. No, I from the operations perspective, I think one of the things that we have also, I think since 2018, I think the strategic direction that the board created in 2017 was really what really propelled us to start thinking differently. And we're using a different language operationally. We're calling it a systems change approach, which also looks at those elements that Kimberly was talking about earlier on. Is we need to stop just doing programs, just for the sake of having programs, and participants are coming to the programs, and maybe they will benefit or maybe they will not. Or if 20 people participate, maybe 5 would use that to change what is happening. But if nothing changes within the system and the institutions, we will always be looking for money to do programs, and then look for money to do programs and funding to do programs. And that's all we're going to be doing. And so I've said this to the board, but I also say this to the staff. In the long run, our objective has to be to put TAIBU out of business, because our work should be focused on changing the system, right? So we have a program for Black students in schools who are disproportionately impacted by suspension and expulsion.
Wow.
The Black students population in one school board here in Toronto is about 12%, but they represent about 40% of suspension and expulsions.
Wow.
It's crazy. So we have a program that deals with suspension and expulsion, maybe prevention, and maybe working with, and also having some legal support to fight back against those suspensions. But if that's all that we're going to do, we will need millions of donors to do this on a yearly basis. We need to engage the system change, and that's kind of what transformative approach feels like. You really engage the systems, and the school system is the problem, so they need to change, not so much the students. So as the board is thinking about transformative governance, we're also looking at systems change in our operational perspective.
Right.
And Liban, it's not at the school, but then where
Yeah.
the universities
Yes.
and the colleges
For
and where they're
secondary
training
education. Yeah.
the
Oh, yeah.
educate
Yeah.
exactly.
The whole system that is connected to those, right?
Absolutely.
And how do we support parents? Because parents usually, when government provides funding for youth, the parents are not included. And you can't work with youth or children without the parents' support and their needs, addressing their needs too. So looking at the system,
The ecosystem.
the ecosystem is the approach that we have begun to use. And equity can only be achieved through addressing the systems, because it's a systemic barrier and challenge.
Of course,
Nature.
of course, and of course that connects to the whole value of unity and putting people first, which you all talked about.
Yeah.
You can't
Collective responsibility. Yeah.
you can't look at things in silos and think that what's going on with children is separate from the system, because children are a part of the system. They're a product of the system in a sense.
Absolutely.
Yeah.
I tend to say that all of our actions are all of our decisions and actions have political currency. Right. And I don't think people think about it as such. Like when you make a decision, they're not worried about how that ripple effect is going to, right? Especially Black bodies.
Yes. Yeah. The personal is always political, right?
Yes.
And you talked about the thing about what are you willing to change internally in order to benefit externally, and I think that's so powerful. When you talk about transformation and you talk about change, there's always going to be resistance, always, and I'm sure you all have faced resistance in trying to implement this. What kind of strategies or approaches did you use to deal with that resistance, with the challenges that might have come?
I think from an operational perspective, one of the things that we try to do is building relationship with the system. There are some systems that you can start building a positive relationship so that you have least resistance. Resistance is going to exist. The system is not going to let go just like that. And as one board member and colleague, Paul Bailey, says, the system does not care about us and is not going to come to our rescue. We have to engage them. And so how we engage and building relationship with systems has been helpful in having the least resistance. It doesn't eliminate the resistance, but it will be the least resistance. The other I think what has been this time around, I think what has been helpful is the painful murder of George Floyd and what has taken place after that has shifted people for whatever intention, whether it's genuine intention or it's a sense of guilt or a reaction to what they have witnessed. There has been a little bit better engagement from stakeholders that we have never engaged with, whether it's corporations or government or institutions, who are now at least showing us indication that they want to listen. And so we are using that into entering and slowly challenging their thinking and the way they practice. So with BGLP, we have been quite busy last year, both from, BGLP is now becoming known and people are saying, oh, this is a great program to get involved with, but also because of the awakening that has taken place last year. A lot of organizations want to do something and they're looking for something, right? So that has also given us an opportunity to go and, disrupt the space gently but forcefully. Like what I'm saying, we appear to be gently and we're providing suggestions and they're listening and they're saying, okay, we are ready. So that's where we have been effective, but it's a long journey. It's a long
Absolutely.
Can imagine.
And I guess on the board side of things, we talked about judiciary, strategic, and generative. I think at the board level, it's providing a lot of space to have conversations. So letting board agendas to breathe so that we could actually talk and unpack. And for those who had difference of opinions, to actually get to the root of the concern.
Mm-hmm.
And I think putting the human, and so you've heard that, right? The relationships
Yes.
as the priority, so that people feel heard, feel seen, right? Feel like their opinions are being accounted for within the board context.
Mm-hmm.
That's within the board structure of TAIBU. Outside, I think one way that we've been doing that with the resistance too is reminding people, remember those statements that you made last year?
Mm.
This is the work that goes with it, right? And for them to be like, because again, oftentimes they're like, we don't know where we start. We're overwhelmed. This is a lot. And so reminding them that this is the statement, and you can't put out statements like that without realizing, not following it up with action,
Yes.
because that's also harmful.
Yes.
And that's also now perpetuating systems and structures, right? Because it's getting us, it's creating work, extra work on our behalf, right? That's energy and resources that could be redirected to actually changing things, right? So being able to take those words, which goes back to the accountability piece that we started off the conversation with, right? Going back and saying you're accountable to this group. You can't make these statements and just have them be empty words.
Yeah. Mm-hmm. From where I stand, folks, I think, this is an excellent case study, as it were. I think it's going to be in a book one day for people of the African diaspora to be around the world kind of studying it. I see a question: how do you do all these changes and provide all these support without creating a dependency syndrome? From Stacey.
So yeah, so as I was saying earlier on, I think our long-term objective and aim is to get TAIBU out of business.
Mm.
The system needs to operate, right? People talk about the system is broken. The system was designed to operate this way
That's right.
from day one.
That's
And
right.
so it's the system that needs to change. And if the system is changing, then there is no need for services such as this, because the system should be providing culturally appropriate, services that meet the needs of everyone, not
Mm-hmm.
just racialized, indigenous, black. Everyone should receive the support that they need. So that's one piece in terms of the long term. But coming to the question about dependency, I think um, there is dependency already, right?
Mm-hmm.
People need a service, so that they must be dependent on a program. But the work that we do, for example, with children and youth, is about building their capacity. For example, we have an academic mentorship program, and the
Mm-hmm.
academic mentorship program, uh, you know, um, there are so many after-school programs here, right? Children come to after-school programs, they eat a little bit, they do their homework, and they play around.
Mm-hmm.
Our academic mentorship program has components, structured components, where we are developing the leadership skills of the children. They go through a theme of, what does school comfortability looks like? What is a good positive student-teacher relationship? How does anti-black racism, is perceived, and discrimination is perceived in your schools?
Mm-hmm.
Those kind of things that we talk to them, so they are now able to voice their concern when they need to, or better understand their awareness, increase their awareness around their environment and what kind of support that they need. We do the same thing with the parents, so that parents are also, on the same wavelength with their what is happening with their kids, so that the parents now are also empowered
Mm-hmm.
by addressing their social determinants of health, whether it's income or unemployment or housing conditions. Will provide those practical support, but also engaging them in programs, conversation, and discussion, so they are now better able to support their children when it comes to not just homework assignment and stuff like that, but when they are facing challenges, how can they be able to provide support and build capacity for their children. So the way we do things is not just providing the program so that people come and get services. It's
Mm-hmm.
also not just about service change or systems change, but it's also building capacity, right? That's the African principle of building capacity within ourselves.
And
Yes.
would you say, Liban, also empowerment,
That's
right?
building capacity and
Because,
empowerment, so that
yeah.
people can occupy the space. And even with the 4 A's that we have engaged, the last piece, I will not say the name because I don't want to offend Kimberly, who doesn't like that word. But building ally relationship is about advocacy is about holding space where
Yes.
people cannot occupy that space, and you occupying that space on their behalf to do that.
Mm-hmm.
The ultimate goal of all our kind of a model of working through this for pathways is really at the end is about empowering communities so they are able to occupy the space themselves. That is what
Right.
ally relationship is. Us as an
Yes.
organization should be able to do that, and that's what we're trying to do with the seniors program, is
Mm-hmm.
that they are now occupying the space where they need to occupy it. The same
Yes.
thing we would do with youth projects. I mean, we have so many other projects that we do, but we don't have time to go through all that. But it's about the youth also being able
Yes.
to advocate on their behalf,
Mm-hmm.
for themselves in the school system by building their capacity and empowerment.
Yes.
Around diabetes, that's what we're trying to do with everything that we do. And also when we go and do BGLP program with mainstream organizations, is we're telling them, if you're really genuine about equity work, this is the path that you have to follow. You need to acknowledge that your system is wrong, is not working.
Mm-hmm.
You need to create an accountability process.
Mm-hmm.
In the meantime, we want you to advocate on behalf of these voices that are marginalized.
Mm-hmm.
You hold space, you hold power, you have money, you have influence. You can be the voice of those people,
Yes.
but you can't stop there. You need to move out so that you can allow now people to take
Somebody
that
else.
space so that now they are able to advocate for themselves, and that is the
Yes.
path that you need to follow. So we're really actually addressing the dependencies piece by
Yes.
going through these stages and phases.
And building capacity. Absolutely amazing. One last thing I want to ask you all, because I don't want to keep you too long. The other thing I want to, the last thing I want to ask you is that, Liban talked about capacity building to move people from the spaces in which they may not be optimal spaces. But Kimberly and Laban, a lot of what you said, and you didn't explicitly say it, but I heard it in between the lines, was the importance of communication and the commitment to communication and the role that plays in building relationships and networks. If there are people in the audience and people in the future who watch this conversation and come from spaces where they want to do this kind of thing, they want to move from transactional organizations and systems to transformational, what would be the one piece of advice you would give them to start the process, to get started?
So I will go first, Leaving, because I would love to give you the last word on this one. Um, for me, I think there's a few things. One, it's okay not to know,
Mm,
right? And it's okay to say you don't know, which means that you need to bring a level of humility to the space,
definitely.
right? And if you start there,
Mm-hmm.
and you ask questions, but then you also do the work yourself, right? Because we know the emotional labor of this work on Black bodies, right? We're not here to educate everybody,
Mm-hmm.
but you have to be willing to do the work
Mm-hmm.
and be committed to it and to understand it's a process. It's not a checkbox.
Mm-hmm.
It's not going to happen quickly. You got to be committed to this. And then the last piece I will say is be gentle with yourself in this work. There's going to be days where things like today feel amazing, and I feel like we can go conquer everything right now. I'm like, what are we taking? What are we taking on? And then there's days where you're going to be absolutely exhausted and you can't get defeated in those moments, right? And so, with that, the importance of having community and having your tribe that you can go to, a soft place to land, knowing how to create those boundaries so that you don't get eaten alive, right? And that our Blackness isn't consumed. So I will leave that there.
Thank you, Kimberly.
Mm-hmm.
If I have to add anything, at least what I'm thinking is, for this problem has existed for generations and generations
Yes.
and generations, and sometimes even thinking and pondering about bringing about change could be overwhelming,
Mm-hmm.
right? And sometimes even kind of defeating to say, really, is the system going to change?
Mm-hmm.
Right? And there are days when we feel here as an organization, or myself, saying, am I kidding myself, really? I mean, like, I go to some meetings and it's the same thing over and over again, and like, you come back and you
Groundhog
say,
Day.
this is not going to change, right? It's not going to.
Yes.
But it is going to change. And I think we've seen, and the change comes very slowly, as Kimberly said. So I think, the belief, number one, the commitment to say that this change, we have no other option. We
Yes.
have no other option. I think this is the only option we have to kind of pursue this and persist. So perseverance is going to be, patience is going to be very important. I think bringing the community along the journey is gonna be very, very important. One of the things that at least I can say here, and not because Kimberly was my previous boss, but one of the things that we've done at TAIBU is really the community relationship. We have the relationship, we have the community is
Right.
very, very strong. If we
Yes.
have an event, now it's COVID, but we don't have an event. If we have an event, um, let's say we have an event Tuesday, we only have to inform 5 people that we know of, and by Tuesday we would have a full house here at Taibu. 100 plus
Wow.
people would come.
That's a strong
One,
work.
there is a good network that has been developed. Two, this organization for them is not where they come and get services and they go. This is their organization.
Mm-hmm.
Like we talked about accountability.
Yes.
I get called out when something, like if the meeting space is not clean, when the
Mm-hmm.
seniors come, they will come automatically to the front desk and they will say, please call Liban out, right? And I will be taken to task and say, do you want, how come you want us to meet in this place when this place has not been clean, right? So this
Mm,
is their place and they have taken ownership. That kind of a
yes.
relationship is where the strength, the hope, the moving together, the slowing down together, the frustration together comes. And I think the commitment, the perseverance, the patience, and bringing community together is going to be very important. um,
Yes.
I mean, there are other political things that we need to start doing as well. We need to start engaging around lobbying. This is something we have not learned, at least in Canada. I know within the Black communities, we don't do lobbying enough. We don't
Fundraising.
engage political people enough. We don't do a lot of fundraising and building our not just financial capital but social capital. Those
Yes.
are the kind of things that we need to think about on a larger scale. But
Yes.
starting with community engagement and that perseverance and journey, starting the journey will be very important.
Wow. Liban and Kimberly, I want to thank you for first saying yes to this conversation
Oh
and
no.
for, of course,
Absolutely.
giving us your time and your energy and all that you've done in your space. I mean, I think it's totally inspiring, and many people are probably going to learn from this. On behalf of the organization, I want to say thank you again. And the last thing that I want to leave for the audience is what Liban just said about hope. I think for people across the African diaspora and even on the continent, in order for us to really shift, we have to believe in hope. We have to believe that there's another possibility and that things can change. Yeah.
Absolutely.
So
Absolutely.
thank you again,
Thank you.
and
Thank you. Thank you.
we'll be in touch. Take care.
All right. Thank
Absolutely.
you.
Thank you. Thank you.
Thank you for joining us for this conversation at the Black Consciousness Festival. All of our sessions are available on our website, theblackconsciousnessfestival.com, and on our Facebook page and YouTube channel. All of our conversations are intense, fun, enriching, and may also be challenging as we explore different facets of our history as people of African descent. Remember, you can find more on the festival on our website, theblackconsciousnessfestival.com. Have a good night, good evening, good afternoon, and a good morning, wherever you are joining us from. And remember to walk in pride, power, and practice. Thank you.